Hope you had a nice coffee break. So we're now going to move into our idea exchange workshops, which, as I said, is the bit where you get to do some actual engaging with each other. So it's designed to allow you to network and consider several workforce priorities. So each session will feature an introduction to the topics. So our panel behind me will basically spend a couple of minutes telling you about their theme and what they want to talk about, basically their pitch to you to go and join them on the table where they're going to be talking and moderating the conversation. As I said, it's all colour-coded, so should make perfect sense. We did it last year and it worked really well, so hopefully it will do again. So basically the idea is it's a great opportunity to offer some insight on your own initiatives and challenges and obviously learn from peers and colleagues at the same time. So our first theme is workforce strategy, education and preceptorship. And as I said, we're going to be hearing from our panel in just a sec when I go and join them, who will introduce what their particular table is going to be talking about, and then basically pick your table and go and sit on it, and then we'll get the conversation going for about half an hour, and then they'll be scribbling down on the bits of paper on the tables as we go through, and then at the end of the session they will join me again up here and basically feedback on all the things you've discussed, shared, decided, and obviously solved whatever problems. So yeah, I'm just going to go and join my panelists. Right, so if you could basically starting, well, as we'll go around in a graceful archway. If you can introduce yourself and give us your pitch for your table.
Thanks, Steve. I'm Julie Bliss, and I'm a Senior Nursing Education Advisor with the Nursing and Midwifery Council, and it's really great to be here today to talk about the long-term workforce plan. What I've been asked to do is talk about the inclusion in the long-term workforce plan, about the practice learning hours, particularly for nursing. And I wanted to share with you some of the work that the Nursing and Midwifery Council will be doing, and look forward to some of you joining me to further the discussion on the tables. So you will know that the Nursing and Midwifery Council made some changes to their education standards that were approved by the January Council this calendar year. That was following the departure from the European Union, some changes around the EU directives for practice learning requirements, and so on. And part of that work was undertaken by commissioning some research to look at practice learning hours internationally. And there were 7 countries that were looked at, and we know that across the globe there is variation in relation to the practice learning hours that are required for nursing programs leading to registration. I think it's really important to put that within context. The Nursing and Midwifery Council is the regulator. It's about protecting the public safety and also working with colleagues in health and care to make sure that care is delivered safely and the students have a good learning experience. So actually, it's a little bit more complex than just thinking about the practice learning hours. So what we are going to be doing is looking at practice learning and a review of practice learning. So from the work that was undertaken by the research that was published in 2021 and is on the Nursing and Midwifery Council website, we know that there are several things that impact on practice learning. It's really important that theory and practice are integrated. So we're talking about practice learning today, but that's not without consideration of the theoretical component of programs of study. It's really important that that practice learning experience is the best it can be, making the use of a variety of opportunities for learning within the practice setting, wherever that might be: health, social care, community, independent charity sector, etc. The other thing that we identified in the research is that there are very many different ways of supporting students in their practice learning experience. And Jane was talking earlier about the pressures on staff in clinical practice. And we currently, our students are supported by practice supervisors and practice assessors who are also delivering the care. That's different when you look at some of the work that's happening, the way that nurses are educated internationally. So what we are planning to do is to commission 2 pieces of work, independent research, one to look at practice learning in the UK, how it works across the 4 countries, what works well, how can we learn from each other, but also to look in more detail at the international programmes for study and find out how that works, how are students supported, how does it go together to add to that rich learning experience. And then we will be able to make some recommendations. Throughout all of this, there will be stakeholder engagement. And one of the things that we're really keen to know is about examples of innovation and best practice. What are you doing that's working really well to support the pre-registration student nurses and midwives and nursing associates? Apologies, I know it's the Nursing Times conference. So that's where we're looking to go forward, and I look forward to the discussion.
Great, thank you, Julie. So Julie is talking about placement hours and practice learning, and she's going to be on the green tables, which, well, they've got green tablecloths, so quite obvious where they are. So that's Julie. Moving on to Gemma. We've got 2 Gemmas, so yeah.
Thank you. So I'm Gemma Stacey. I'm the Deputy Chief Exec at the Florence Nightingale Foundation. And my table, the blue table, is going to very much align with what we've just heard from Julie around how we can start to think very differently around increasing capacity in order to be able to educate more nurses and really be able to meet that target of a huge increase in the number of student places that we're able to offer through our education providers and also our practice placement providers. Now, I think this table is really important for the people that are here in the room today, because we are going to need to really reimagine our traditional ideas around what our programmes of study currently look like if we are going to be able to meet this demand. And we really need to acknowledge that this has got 2 drivers. There is absolutely that political driver around increasing the numbers, so increasing capacity. But there's also a really key driver that we've heard from Julie there around actually being able to relook at the quality of that learning experience and think very differently around the types of learning experiences that enable our nurses to graduate confident and also competent to fulfil their roles as registered nurses. And that's not just now, it's about how that environment is changing into the short-term and medium and long-term future. And one of the key things I think is really important for us to acknowledge is that whilst the NMC have looked internationally around what that evidence base is, what we're hearing is that there's no real consensus around what it is that enables practice experience to equal competence. And so we're really keen to hear on your experiences, some of those real life case study examples of what you have identified as most effective and where your students have really demonstrated to you that real increase in confidence around their capability and their motivation and desire and excitement around their future career. So I have 3 things I would like to talk to you about. I'd love to hear more about your experiences, about how you have reimagined practice learning to enable you to create that great quality experience. I want to know what you think about simulation. Is simulation part of the solution to this issue? Should we be considering simulation as a substitute for what we might have seen as a traditional practice experience? And what other models and approaches have we not even thought about? What can we think in terms of a blank sheet of paper and be able to say to the NMC, these are the kinds of things we should now be considering good quality learning experiences?
Fantastic. Thank you, Gemma. So that's creating more nurse and midwife student places. That's on blue, which is just over here. So moving on to Lucy.
So hi, I'm Lucy Llewellyn. I'm an associate professor in nursing at Kingston University and their apprenticeship lead. I'm going to be looking on the pink tables about how we can increase numbers for student nurses through apprenticeship training. Now, as Mark quite rightly said, there is a rhetoric that this is a lesser route into nursing, and I can assure you we deliver exactly the same programme for our RNDAs as we do with our UCAS students. It's just done in a very different way, and we find our learners that come through this route are exceptional, and I'm not biased because I've got 4 fantastic ones I can think of off the top of my head. I'd like to talk about apprenticeships and what we can do to support practice to enable more students to come through this route, as you all have fantastic healthcare support workers, qualified nursing associates who are looking at that next step to become registered nurses, and what we can do in a cost of living crisis to support them to do this and earn while they learn, which is what they see as a valuable route. I appreciate there are a number of factors that inhibit you to release staff to do this. So what I am interested in is what we can do from an employer to a university perspective to support this, what message we need to take back to the higher powers to help you get more staff on courses, and anything else you think about apprenticeships that will help us increase those numbers to meet the long-term workforce plan.
Fantastic. Thank you, Lucy. So, yeah, Lucy's talking about apprenticeships, which is on the pink tables, which I think are these ones here. And last but not least, we've got another Gemma. Thank you.
Gemma 2, or Gemma Woodcock. I'm the interloper here. I'm from IBM, and we're talking technology. So together with non-EC from IEL's Medical, we're going to be talking about AI in general, and also some specifics around using VR to assist training. AI, I think AI has hit us all. We all know we use AI on a daily basis. Pretty much everything you do on your phone is using AI of one sort or another. There's been a lot of discussion over the last year or so, prompted nearly a year ago by ChatGPT, which got everybody talking about this new aspect called generative AI. And there's been a lot of discussion and fear-mongering around what this is going to do to the workforce. I'm in my 40th year in the IT industry, 40th year in IBM. I've seen a lot of change. I've seen a lot of times when people say, oh, it's all going to change. We are going to see changes. It's not going to take all of our jobs. I'm pretty confident of that. But what it has a real opportunity to do is to take away a lot of the drudgery of the people, like yourselves, and make the job less, to handle a lot of that admin, to handle a lot of the stuff that really doesn't give you a lot of satisfaction. So if you think of the other topics that we're talking about, I see AI as a real opportunity to improve the quality of work and to help offload some of that drudgery, and therefore hopefully better retention, and ultimately making better use of the limited resources that we've got in the NHS. So we'll be on the yellow tables. My colleague from IBM will be helping with this. We'll be looking at the VR for training, but we'll also be looking at AI from simplistic things like helping HR through to more advanced use.
Perfect, thank you. Thank you, Gemma. So yeah, yellow over there, AI and technology. So yeah, great pitches from everyone. So please now go and basically sit on the table that sounds interesting to you. And I'll see you in about half an hour. All right, everybody. Afraid we have now run out of time. So if the facilitators, moderators, could you return to the stage, please, with your all-important notes, ready for the feedback. Yeah. So yeah, thank you very much, everybody, for engaging and taking part in the workshops. Hope it was good. Looked like some really good conversations going on. So we'll now have the feedback, and then after that it will be lunch. Just while the facilitators are returning to the stage. Just a couple of quick plugs. Professor Jane Ball, who was speaking earlier, she's left flyers around the place about her survey on the mental health nursing workforce. If you can have a go at filling those in, there's a QR code, so if you find one of those, that will help Jane out with her research. And also Professor Gemma Stacey, who was one of our moderators, has helped write a book, which I'm holding up now, which they'll be doing a session looking at what their book's about at lunchtime as well. So, okay, I've got 3 back, waiting for one more.
Yeah, we do like.
All right.
Nice. Work experience.
Everybody ready? That'll be a no. All right, everyone. We've got about 20 minutes before lunch. And it'd be great to hear what you've been speaking about. So if you could just have attention on the stage, please, that would be much appreciated.
It's hard to keep moving around. We should get more conversation.
All right. Okay, so obviously the moderators are frantically writing down last-minute notes. I see Julie is. So. Right, so we've got about 20 minutes left, so there's about 5 minutes per table. So, thank you very much. Okay. Well, again, as we're in perfect person order as we were the first time round, Julie, what have you been talking about on your table? What were the...
Thank you. So we were talking about practice learning, talking about the hours, but actually thinking about the bigger picture of practice learning. I'd like to apologise firstly for not making it to the last table until the very end, but thank you for everybody who contributed to the discussion. I think it was a really interesting discussion as a starting point. I think there'll be much more to come out of the discussions as we go forward. We talked about the importance of the quality of the learning as well as the quantity. We talked about some of the challenges. So one of the things that was brought up is that there is a range of learners within the clinical setting. So we talked about, the registered nurse associate, nursing students, we talked about allied health professionals, but we also talked about the professional learners. So one of our colleagues was talking about working in intensive care and qualified staff being supernumerary for a period as they're supported. And it's within that context that we need to be thinking about this work. We talked about, how are people prepared to support students? In relation to that. So the NMC standards for student supervision and assessment talk about local preparation for practice supervisors and practice assessors. We know that there are a range of other education preparation programs available, and certainly colleagues were talking about a range of different roles, practice development facilitators, clinical educators, and so on. So it will be really interesting as we go forward with this work from the Nursing and Midwifery Council to find out what is in place and what's working well. One of the things that we also talked about was, the need to understand what happens internationally around supporting pre-registration nursing students from a theory and practice perspective. There is some work on the Nursing and Midwifery Council website. There was an international benchmarking exercise that was reported in 2021. We want to build on that in relation to that. The other thing that we talked about was preceptorship and how that fits in with the supporting students in practice. So as an example, did I say this on the stage? Do you know, it's all a blur. I don't know if I've already said this to everybody, but in Ireland, the students do clinical placements for a period and then do a paid internship. And if that's a repetition, I can only apologise.
No, you didn't, I don't think. Someone made a point about Ireland. I think it was Jane,
good.
I think, in the previous session.
I've been writing things down. So yes, and that, for me, that sort of fits with Jane's point about the number of nurses to 1,000 population. That fits quite nicely. That will be what it is. So we talked about a lot of things. I'm very excited to look at the flip chart because I know there's lots more written down than I have shared. But as I say, it's the beginning of the work, and we will be, welcoming thoughts and ideas from everyone. Thank you.
Fantastic. Thank you, Julie. And on to Gemma, who was talking about a similar subject.
Yeah, very, very similar, and lots of triangulation in our conversation. I thought I'd start off with a quote. I hope one of our table members doesn't mind. Why do we keep assuming that 10 weeks of hell is better than 2 weeks of good quality learning? I thought that captures one of the challenges that we have really brilliantly. So what we were talking about is really going back to that systems level thinking that Jane referenced earlier. So we often talk about clinical demand and how do we model clinical demand so we understand what workforce is needed in what area at what time, but we don't apply those same principles to learner demand and really think about the infrastructure that's needed to properly resource the education for the multiple learners that Julia just mentioned. We also need to acknowledge that being an educator is a skill in its own right, and the assumption that every registrant has the ability and the know-how to be able to enhance the learning of another person, to inspire them and motivate them, is one that we've relied on for a long time to fulfill this expectation, but not one that we should continue to if we genuinely want to improve the quality of learning in practice. We talked about starting with the endpoint and that endpoint should be quite different to what it has been traditionally. So if we're wanting systems thinkers, systems clinicians, then we need to be giving these students exposure through their practice learning into systems ways of working, thinking, leadership, all of those things. And our traditional placement models don't achieve that at the moment. So we've got to unlock some experiences and access to different kinds of nursing practice in areas where previously they've not been accessible to students. And a particular area we talked about was around advanced practice and clinical specialism, where there's a perception that because this is advanced, it's not relevant to the students at that time. It's something that they would need to build to. But actually what they're being exposed to is accountability, decision-making, multidisciplinary team working at its highest level, and that's absolutely essential for our students to be able to experience and learn from. Our final area of discussion, and there were some amazing examples about how simulation is being used really innovatively to enhance the learning experience. And some really good points around actually this can be an early identifier if there is a problem with a student's confidence or competence in a particular area. So in a safe way we can really target and support that student. But there was a clear consensus across the tables that simulation isn't a substitute for application to real world practice. So we have to think about simulation as an aid and a facilitator, but not an instead of.
Great, thank you very much. Very interesting simulation. Lucy, over to you.
So we looked at what the challenges were and came up with solutions like all good managers should do. So we considered challenges being financial, which was seen in all tables in terms of backfill, the tariff for placements, which isn't there for apprentices. And if we want to increase the number of apprentices, will we have enough levy to meet that demand? There was a good discussion around what the scope of practice is. So from nursing associates through to the registered nurse degree apprenticeship. And so looking at what is always the difficult one, what they can do and what they can't do, and there's discrepancies between employers across the piece. And how do we endeavour to have that flexibility? There was a really good conversation about flexibility in workforce and getting it right from the beginning so it carries through the career progression. And one thing that was really very evident, if we don't get this right, there's a real risk of those we've trained either through the senior healthcare assistant or the nursing associate, if the opportunities aren't there for them to go on to their next step, if that's what they want, we will lose those valuable members of staff to either fee-paying UCAS routes or to other employers. And that was very, very evident on tables. So we had some solutions. Build into establishments, nursing associate and registered nurse degree apprenticeship, so the training places are there. Having that clear guidance on scope of practice, having a flexible levy, so being able to use the money only for the training costs, but maybe towards tariffs, so we can support our students, but also enable them to maybe apply for money towards other additional costs, like travel costs that suddenly go up when they go out on placement. Prioritising those sectors in need and minimum service agreement to retain the learners post-qualification within the NHS so they don't go to another employer. And also having that very clear career progression. So for our nursing associates, to keep them in nursing associate roles if that's where they want to be, absolute CPD career progression to keep them engaged, developing. It's a generic programme so they can specialise in their areas. What was very clear is we want motivational speakers and to really get the role out there of what an apprenticeship is. And someone alluded to the Navy advert and maybe having something similar to that to really engage people with what the role is and apprenticeships being a route. And there was a really nice discussion about use the sort of cost benefit of growing our own, using apprenticeship versus international nurse recruitment. And that was a really good discussion on one of our tables, and having a sustainable solution, so growing your own, which would be. So there's some really, really interesting points. Again, I will be interested to see what's on the rest of my posters, because there's a lot of valuable information. Thank you.
Excellent. Thank you very much. So that Navy advert's come up a few times.
Yeah,
now, actually.
we like that.
And Gemma?
Well, if Gemma, I could reuse that quote. Let's just say that the 10 weeks of hell versus 2 weeks of... It's not unique to medical training. Anyway, so as you might imagine, we had quite an active discussion on technology on the yellow tables. Just to give you an idea, that's one table. So there's plenty of discussion. And in my experience, these sorts of things takes a few minutes to warm up the discussion. Absolutely not a problem. So we looked at VR in particular, but we also looked at more general AI use cases. So VR for training and the real values there of it being much more flexible in terms of potentially allowing training in people's own, to fit with their own agenda or their own timescale. So potentially available 24/7. That it gives you access to real leaders in the field. So rather than actually having to pull people in to do face-to-face training, it gives you much more flexibility in terms of the access. The biggest concern, of course, is that you lose the patient interaction, and so that has to be fundamentally part of it. But going back to the positives, being able to use the VR outside of training potentially to talk to children with anxiety, to remove that sort of personal stress, if you like. And we looked at how AI in general can be really strong as if you use AI to mean augmented intelligence. But if you go too far and you start using, if you like, Google the symptoms, we all know that everybody starts Googling symptoms and all of a sudden you've got some form of cancer. So to be able to govern the process so that you can control the responses. So some of the other things that came up from a VR point of view, being able to use VR out in the field so that you can bring expertise effectively onto the site of a particular situation, then could be very useful there to help with triage. And what was the other? A request to make the VR more realistic. And of course, we all know that with technology, these things come on as we progress. In terms of concerns, one of the big ones, of course, is cost, and the other is the impact on existing systems and connectivity with existing systems. And one of the things that we're looking at is that connectivity, that data flow, if you like, between systems, and using AI as a front end to give you access to lots of systems in one go, rather than having to learn access to one system, learn access to another system, and to have a much easier interface into multiple systems. So really interactive. Thank you for everybody on the yellow tables, and yeah, I think that's it.
Well, great. Thank you, panel. I'll get you to do one more thing in a second, which is just to give me a take-home. You know, obviously had some brilliant discussions there, just to distill it into one thing. But thank you very much to everyone for taking part in that first round of workshops. Sounds like you had a really, really interesting and rich discussion. As I said, we'll be going to lunch in about 5 minutes. But before then, as I promised the panel, I'm just going to get their take-home, basically, out of all the notes that they've made. What was the one thing, Julie, that sat with you?
This is the one moment I'd like you to start at the other end. No, I think, you know, the people that I was able to speak to, there was a genuine interest in making sure that the practice learning for pre-registration nursing students links to the theoretical component, but also that the quality is the issue. It's not necessarily the quantity, but the quality and all the things that feed into it, and there were many. So that was really helpful, and I think the 10 weeks versus 2 weeks probably rings true across the board. So thank you for the discussions. Yeah.
Great, thank you. Gemma, was there anything that jumped out?
I think for me there was that point around modelling the learner demand, not just the clinical demand, because I think until we genuinely understand the infrastructure and resource needed to properly support the learner demand, we will continue to ask people to do this on top of those clinical demands, and it will always have to, quite rightly, become second priority. So for me that seems like the missing piece of the jigsaw that the tables identified, that if we are genuinely going to do something differently, we genuinely need to understand the resource to support it.
Great, thank you. And Lucy?
I think it's something similar. It's actually, everyone recognised the benefits of using the apprenticeship route to grow our own staff, but it's how do we make it the reality? What can we get to actually increase those numbers? And really, it's financial input.
Sad but true. And Gemma?
So one of our contributors said, it's a tool. And that's technology, that's all technology should be, is a tool. Yeah, technology advances all of the time. I've seen it through 40 years. And it's amazing what we can do now, and it will continue to amaze us. But it is a tool, and we should be using it to augment what we do. And I don't see it as replacing what we do.
Perfect. Well, thank you very much, panel. So Julie, Gemma, Lucy and Gemma. It's lunchtime, but before you run off, there's a nice segue between the technology that we were talking about there and Gemma, because Gemma is the author of a book called, I'll just read it off here, it's Digital Technology and Data for Nursing Practice, and Gemma and her fellow authors, co-authors, are going to be in the exhibition area. That's right, isn't it? Yeah. Yep. So to tell you all more about it. So yeah, basically, please take that opportunity to have a chat with Gemma about this great new book that they've written. So thank you, everybody, and enjoy your lunch.